Hello, and welcome to Wellness Wednesday with 3W. Wellness Wednesday is sponsored by 3W Medical for Women, a nonprofit medical clinic offering free of charge or low-cost reproductive health services to women in the Seattle area, regardless of income or insurance status. 3W does not profit off of the reproductive health choices women make. The information shared in this podcast is the opinion of the speaker or speakers. Medical information is not intended as individual medical consultation, but for general education only. Always consult your own health professional for personalized advice regarding medical decisions. And if you're in the Seattle area, consider making an appointment to consult with us. I'm Helen Nguyen, CEO and co-founder of 3W Medical for Women and the host of today's podcast. Hello there, Wellness Wednesday listeners. This is Helen Nguyen, yours truly, host of our 3W podcast. Thank you so much for joining us again. So grateful for every time you tune in to a new episode. Today we have as our guest speaker this amazing young woman who is adorable, by the way, and she's so cute. I want to put her in my pocket. And her name is Tenny Larsen. Hi, Tenny.
Hi.
Hi. And she's going to just share her experience finding accessible healthcare around our UW campus. She's a UW student currently. We're just been chatting about our educational experience from the University of Washington. Would love to learn more about you, Tenny. So let's dive in. You are sophomore, going into your junior year.
Yep, going into my junior year.
Okay.
2 years down.
Okay. How is that feeling?
It's really crazy that 2 years has already passed.
Yeah.
It
Isn't it
feels
so
like
fast?
yesterday that my parents dropped me off at college. It's really weird. And now I live up here full time and I'm in my major and it's just everything's becoming really real.
Yes.
And 2 years left to go, trying to treasure every single moment of it.
Oh,
because I know
so
I'm
cute.
already going to miss it.
You're so sweet. I still have nightmares about finals.
Oh, yeah. No, I have sweat dreams about it. I'll wake up and I'm panicking and I'm it's summer. You don't have to take a final. It's okay. It's okay.
Yeah. I think I've been out of college for close to 12 years now. And I still have in the middle of the night, wake up going, I didn't study for my final. And my husband's like, dude, you don't have to study for anything. So
no.
Kudos to you for sticking it out.
Thank you.
You are going to do great and fine. And what is your major?
So I'm a public health, global health major, BA, and then my minor is bioethics and humanities.
Whoa.
So I'm just trying to combine those two and hopefully go into hospital administration is my goal. Maybe do some policy work within there. That's why I kind of wanted to minor in bioethics because I felt like that was a good addition to the public health major. You can take some really cool classes for it too. So that's kind of the direction I'm headed right now.
Yeah.
But yeah.
Yeah, we were just chatting before we started recording about how I had no idea hospital administration was a thing you can learn. Personally, I would have really loved and have been interested in hotel management. That's a thing too.
I know, very cool.
I know. And our listeners know how bossy and control freaky I am. I would have really ruled the hotel management thing.
I think you would have too.
I think so too.
I agree.
So you're going to have to forgive my pronunciation of this. So one of the questions is how did you find out about us and what is your involvement with the Panhellenic Association, which is a thing with sororities on
it's
campus,
kind
right?
of, it's the governing body for the 17 NPHC sororities, so National Panhellenic Conference sororities on campus. So we have, I think, we have 17 traditional sororities and then one engineering sorority that we've adopted into our Panhellenic. So they join us. It's super cool, yeah. They can join us and then they get all the benefits from being in Panhellenic too, which is really cool. So I found out about 3W actually from one of my best friends because, one of my best friends, I was kind of in the need of an appointment real quick.
Yeah.
I couldn't get an appointment anywhere else, couldn't find anything. And she's like, well, do you know about 3W? And I said, where's that? What is that?
Yeah.
Tell me more, please.
Yeah.
And so she's like, it's this little clinic that's down on 45th. Just go make an appointment, call. You'll get an appointment sometime within the week and you can go. And so that's how I found out about you guys in the first place. And I've been going here ever since just because it's convenient and accessible.
Yeah.
A lot easier than making other appointments. And then I was thinking I got into Panhellenic and I'm the community engagement chair. So my main responsibilities are scholarship for our whole Panhellenic system and then health and wellness. And so my goal is kind of just to, I feel like there are a lot of resources out there. People just don't know about them. So my whole job is kind of bridging that gap between people and like the resources and connecting them. So I was like, this would be a great opportunity to have them come in and speak to all our Panhellenic members and kind of give them another resource and opportunity that's not on campus that they can go to. And I had you guys come to campus and give that presentation, and I shared the slides with our whole Panhellenic community, and people still come up to me and say thank you for it. Like, thank you guys for coming in. They thought it was a really great presentation. Lots of girls in my own house go there now, and so, or go here now. And so it's been really cool working with you guys, and I feel like it's actually had a really big impact on our community, which has been really cool.
Thank you so much for just saying what you just said and that affirmation. You know, when my friend and I started this clinic when we were 25 as students on the UW, we had no idea what we were doing. But that was our dream, is to have, you know, students be able to access resources that we weren't able to access on campus. You know, being a student at the UW for 6 years, I completely have so many personal experience navigating the healthcare system and how difficult that can be. We live in one of the wealthiest cities with medical resources at our fingertips, and yet it is still so difficult to access good healthcare. And why is that? And what is that, right? And like the UW has a whole hospital, and on campus we have Hall Health. And my personal experience with Hall Health has always been very difficult and tumultuous and just a very difficult system to navigate. I don't know if that's been your experience, Tenny. Like,
I mean, definitely agree with that.
Yeah, no shade to Hall Health, but like sometimes I'm like, I get it, we're students, but we shouldn't be treated like we're subpar patients. That was mine and my friend's experience. And I remember like being very judged for some of my medical decisions and not being taken seriously and being heard as a student, because it was very like, you're a student, we're going to dismiss your needs. And that's why like we really felt this call and this need to create, yes, a very small clinic in big Seattle, but reclaiming what it means, like what real reproductive health care means. And I hope that's been your experience.
Yes. Hall Health it's interesting because they tell us all about it and they really push for you to go to Hall Health. But it's so hard because there's just so many students on this campus, and it just doesn't really have the capacity sometimes to deal with that many students dealing with different medical issues all the time. I remember the first time I tried to call to get an appointment because I had a cold or cough for 3 weeks. I was on hold for like 4 hours. And in that time, I could have gone to urgent care or done something else.
Just go to Indigo.
Exactly.
Street, you know?
So I think it's sometimes hard just because of the volume of students they have, and they just don't have enough people to really focus on all their different patients. And I've had a lot of experiences with friends where they just go get something that's a quick fix, but then they end up having to go back to the doctor anyway. And it's just more of like a temporary fix thing. And then on top of that, I think the hardest thing is for out-of-state students because they don't accept a lot of insurances.
Really?
Yeah. So that's been the main issue with people trying to access Hall Health, is that they don't take everyone's insurance. Especially people from California have a really hard time having their insurance matched there. So I don't know if that's just California in general, but those people have a hard time being insured there, so they can't even go there in the first place. You have your one free visit a quarter or something.
Yeah.
And then if you need anything more than that, it's kind of you're on your own.
Yeah.
So I think that's probably their biggest problem too. It's just they don't have the capacity and they don't accept everyone's insurance. So it's not super accessible to everyone. I would say for Washington State residents, it's definitely more accessible just because they accept a lot of Washington State insurances. But there's a lot of out-of-state students on campus and a lot of international students on campus.
Yeah.
So I think that's kind of one big problem that our campus is having with Hall Health at the moment.
Yeah. Have you guys given them that feedback? Because I know when I was a student, that was something that was still a big problem. And I remember, that one free visit, like savoring it until I was like dying to then be like, I'm going to use this card now. It's like, okay, is this warrant of the free visit?
Exactly.
Or should I save it until like my arm's about to fall off and then I need to go? So, have you guys voice this opinion on, with Hall Health and what has been their response or no response?
Yeah, we haven't really reached out to them, I feel like, as a student body well enough. I know that they have a student-led commission because Panhellenic and I worked with them on a couple different projects last year. And it was great working with them, but even the committee was overrun. Like, I was working with the one girl and she's like, we just have no help. Like, it's just me doing all this work. So I'm so thankful for Panhellenic to come and help out with these things. But I think they're just lacking in people and people at all right now. It's just they just don't have enough students wanting to be involved, enough doctors wanting to be involved. So I think they just have so much going on right now. Yeah.
So with your background in public health, why do you think it's so important for women to have access to accessible healthcare?
I think mainly it's important just because women have been so devalued in our whole history. And I mean, we've been learning a lot about this in public health, that all these textbooks that are still in med schools are meant for white cis men. Like, all the techniques and everything that they're teaching about is catered towards white cis men. It's not catered towards women, not catered towards people of color. So I think it's really important to bridge that gap right now because it's important that women have access to all these healthcare issues. I mean, we experience so much, and so much of it is undervalued, and we're not taken seriously. Like, personally, there's been so many times where I've gone to different doctors and explained my needs and tried to get the help that I needed, and there's just been no help for me. They just don't
dismiss.
Yeah, just dismiss. Don't take me seriously. Not that big of a deal, you know.
So, don't you love it when they say that?
Yeah, it doesn't really hurt that bad. It's not really. You mustn't really not be feeling that.
Yeah.
So, I think it's really important just because we've been so devalued.
Yeah.
All this time, it's important that we have all the things we need to like live the life that everyone else is living, that men are living.
Yes.
The care that they're getting. We should be having the same care for us, especially just because our needs are so specific and important that I feel like there should be a more push to have accessible healthcare for us too. So
yeah. I mean, that's exactly what my friend and I felt when we were, young women, and we were like surrounded by all these medical resources, supposedly, but none of them would spend time to really get down to the root problem. Your typical doctor's appointment these days is like, 10, 15 minutes? And it's being constrained by insurance. It's being constrained by the provider being pressured by the higher ups to see X number of patients a day. And so when we set out to create 3W, we really wanted to create a space for women to just breathe. Just getting to know our medical provider for the first half an hour is so important because just like when you go to a new counselor, you are both feeling each other out. Like, is this going to be a good fit? Is this the right person to take care of my mental health? And so we really approached women's healthcare and reproductive healthcare in that type of vein of like, let's get to know the provider because he or she might not be the right person or like not have the right knowledge or education in that area that I need. Then I could feel like I had some say and direction instead of someone in this like white lab coat telling me, just take this medication and it will go
exactly.
away. It's like, wait, but what is that medication going to do to my body?
Yeah, exactly.
I want to know, right? Because that's informed consent. Like, that shouldn't be something we should request. What's your pulse from being a student on campus, being a woman? Like, how is the university system or healthcare system that you're seeing as a public health student and navigating that? How has that been approaching women's health, and what are some misconceptions that you're seeing spread on campus or about like women's healthcare in general?
I think the biggest misconception is that a lot of people feel like you're going to be judged for going, or you're going to be judged for going to get an STI test or going to take a pregnancy test or something like that. That's a huge misconception. We are so pro for that on campus. Like, that is, especially in Panhellenic, I feel like everyone in my house is very much open about it. We have like very good, honest conversations about what's going on in our life and our health and things like that. Even just last quarter, I made these little goodie baskets for each one of the houses that had like condoms and pregnancy tests in there. And then everyone just put them in their bathroom, and then they were there for everyone to use. And it was like a kind of a judgment-free thing. And we got a lot of good feedback from it. So I think the number one misconception is that you're going to be judged for taking care of your health.
Yeah.
Like, that's the most important thing. And we really try to stress that. That's why all of our houses have health and wellness chairs within their houses too. So you have someone to go to talk to about these things, or that's encouraging you to like lead a healthy life and get good health care and access to health care. I think other misconceptions on campus, like I said before, it's the resources are in one place and the people are in the other, and they just don't ever interact with each other. Like, a lot of people just don't know the different resources we have on campus, because there are good resources that UW does provide, especially now. Like, most recently, they just voted to put different kinds of Plan B pills and the vending machines outside of Hall Health. So you can go get a Plan B in the vending machine and leave. But people don't know where they are or how to use them, or that they exist at all.
So there's a lack of education
surrounding. I think that's the biggest thing, is that they tell you Hall Health, but they don't tell you any of the other resources that they have on campus, which is crazy, because there is a lot of other resources. And I feel like, especially for Panhellenic, there's a ton of resources for our members that we really try to push out there. Like, between me and the people in my position previously, we have this huge comprehensive list of every single resource on campus that we update every quarter, and we send it out every quarter just so people have the information if they were to need it for any reason. And I think the general population of UW doesn't have that, someone sending that to them and telling them. And so they just don't know where to go when they need something.
So that's a really good point that you're making, is like, I had very much similar to your experience. I had no idea what to tap into as a student. We were always told to go to Hall Health or to UW Med when we had any medical issues. But it was like, okay, but my experience wasn't great, so I'd like other options, and what would that look like? So from what I understood when I pushed back on that was, when we opened 3W, we really wanted to collaborate with Hall Health and be a resource to women on campus, because, I mean, let's face it, we can't do everything. You know, we can't deliver babies and do stuff like that. But we can, because of the focus that we have on women's health is very specialized, we're able to like really hyper focus on that specific topic or that specific issue that maybe Hall Health is not able to fully embrace, because, like you said, they're being bombarded by 50,000 students, which is a lot, right? And what I found out is one of the policies that they have is they will not endorse a place like 3W on campus.
Really?
Yes. And one of the things they said was it will be confusing for students to collaborate with a community resource like ours. And I'm like, so you're saying that your students will be confused. So are you telling your students are not very smart to know like where to navigate? Like even putting a brochure, like a 3W brochure in Hall Health, they would not allow us. Isn't that interesting?
That's really you think they would want to do that. That's what I mean. They're so overrun and they can't see as many patients as they would like to. So I would feel like that would like lift some of the burden off of them.
Yes. And
but
we even said like we can't do everything. So we'd be more than happy to send patients your way when we can't do X, Y, or Z. So let's work collaboratively. And it's never been something they want to do.
That's really interesting. I had no idea that they had that policy.
Yeah.
That'd be super interesting to look into that further.
Yeah. I don't know.
Yeah.
It's a very interesting kind of like they've kept us at an arm's length kind of situation. And quite frankly, in my opinion, that's cutting off a resource for women on campus that could look for a second opinion. Right. So like, it's such an honor that you said that, your friend recommend us, because word of mouth is like a big way we advertise, a big way that we get the word out about what we're doing. But that endorsement is so important to us because it lets me know that we did something right. And that you trust your friend enough to come in here and get served and was able to receive healthcare, I hope, the way that you wanted it to look like. And when we talk about misconceptions, like just because we don't provide certain services because we're limited by our nonprofit license, like every time we add a new service, like the ability to our liability insurance like increases. Yeah. We're 100% donor funded. So we have to be really, really careful what types of services we provide. And there's this misconception on campus about who we are. And like before we started recording, I mentioned to you that there's a survey right now circulating across campus that says, don't go to 3W, it's a fake clinic. And I just want to pick your brain and see, like, how would you respond to someone that says that?
I just don't know where they would even get that information. I'm so confused about that.
Yeah.
I get it. They're looking out for students because there are clinics that aren't genuine.
Sure.
But do your research. Like,
yes.
Look into it.
Like, come become a patient.
Yeah.
And just experience it.
Come ask. Like, find out for yourself. Don't just spread harmful information that could have been helpful to someone else. That's just...
Isn't that weird?
I just don't know how that would even start.
Yeah. It's like... I'll send it to you.
Yeah.
It's like a thing that we're constantly being, like, kept at an arm's length from campus. And I'm an alumni,
That is so weird.
I'm an alumni. We have a crap ton of volunteers that are students from campus. Lauren, our operational manager.
Yeah, she was an AD-PI.
Yeah. Sorority girl.
Yeah.
Alumni. Dr. Rutherford.
Yeah.
Got her medical degree from the UW. And yet we're constantly just, nope, you guys can't.
What, did they not trust their own education or something?
That's what I mean. Like, if you trust that you're teaching your students to have critical thought, then if it's a fake clinic or a real clinic, let them decide that for themselves, right?
Yeah.
They should be able to critically think, like, that was a weird experience, never coming back there again. But, just you coming back and telling your story, and it means the world to us, Tenny.
Yeah, of course.
Thank you so much.
It really did help our members in our community. 100%. It gave them another place to go to and gave them another resource when other resources weren't available to them. And so they've really enjoyed being able to come here and have that other resource. I've heard firsthand from so many people, whether that's in my own sorority or outside of my sorority. So
yeah, we need to give you guys megaphones so more people know.
Yeah,
because we get these we get news, we get insider news about these misconceptions about who we are, and so it makes me kind of sad. Like, what the heck? Please come in.
Yeah,
like,
just look.
Like, if we did something wrong, like, just tell us, and we'll fix it or we'll try to improve. But please don't prevent other people from the accessible care that we've tried really, really hard to create. We don't take insurance. We try to get you in the week of, even the day of, and hopefully we're meeting you where you're at, and we just want to love on you.
Yeah.
As your healthcare provider. So what do you think is your primary message to those listeners out there that ran across the survey or has trouble accessing good health care in this area? What's your one message to a young woman that's feeling pretty discouraged right now?
I would say just go look. Go look at all your resources. Go to your friends. Go to people you trust. Go to other members of your community that you know, and really do research about alternative resources that are on and off campus, because they're there for you. They're hiding, but they're there. Yeah. And if you give it a look, you'll find other places that you can go to, that you can trust, that you can eventually recommend to other people, just like I've found through my friends. So my message would be just look into things and do your research and find other places, because there are other places that exist. Like, I guarantee it, 100% you'll find other resources.
Yeah. How important was it for you to access something immediate when you needed it?
Yeah, it was so important.
Yeah.
I was so worried and anxious, and I couldn't get an appointment anywhere, and Planned Parenthood didn't take my insurance. Hall Health, I couldn't get on the phone. And my friend was like, well, just go here. You'll get an appointment this week. And I go, what do you mean? I can't get an appointment anywhere. How would I get an appointment this week? And she's like, just try it. I promise. Call them. And I called, and there was an appointment the next day. And I went, and I've had so many bad experiences, especially with women's healthcare, with different gynecologists and doctors. And so when I came here and they sat me down and like talked about my health and my experiences and what I was looking for, they really took that into consideration. And I felt really safe, and like that anxiety and burden had just gone away.
Yeah.
So
and that's
it was
like
nice.
half of it, right?
Yeah.
When you're in like a crisis situation, or when you're like, I just WebMD this.
Yeah.
Oh my gosh.
Exactly.
You know, and you're just like, whoa, it's just getting worse. I've drawn a circle around it. It's gone beyond that circle now. And it's like, what is this?
It's comforting.
It's comforting to just be like, thank you so much for acknowledging.
Just listening to you and really taking into account what you have to say, which is definitely a new experience, or was for me at least. So,
well, thank you so much for coming back and telling your story and sharing your experience. And I hope that more people, more women, more just more people out there give us a shot to be able to serve them, because that's what we're here to do. And our donors just, oh my gosh. We sent out like that video that you made for us the other day, and they just were like, who is she? And she's adorable.
Oh, stop it.
No, it makes because so many of the times our donors give so generously, but they don't get to see the person that they're impacting, right? And it makes a huge difference when someone like you comes back and give us this endorsement, give us this feedback. We know we're not perfect. We know there's a lot of things we could continue to grow and do, but in that moment of time, we were able to walk alongside you in your healthcare, and that is exactly what our donors are like. That's what we want to hear. Yeah. That's what we support. So I hope you know that there are so many anonymous people out there who care about you and your healthcare and just want to love on you, and make sure you're just good and well, and continue to be this kick-ass public health student.
Thank you.
Yeah. There are people that are proud of you that you don't even know.
Wow.
Yeah.
That's pretty cool.
Yeah. So thank you so much.
Thank you for having me on. It's super fun to come back. I love doing this kind of stuff.
For more information about 3W, please visit our website at 3wmedical.org. That's the number 3, the letter W, medical.org. From there, you can learn more information about the services we provide, book an appointment, or make a donation if you'd like to support our mission. You can also call our office at 206-588-0311. That's 206-588-0311. If you like this episode, please share it with others and consider subscribing on your favorite podcast platform so you never miss an episode. Thank you so much for listening, and until next time, stay healthy and be well.